It's been 4 months since I've had double jaw surgery. I'm about 18 and a half weeks since. I got double jaw surgery March 25th, 2026, and today is July 31st, 2026. And I still need to eat like soft food. I can sort of eat chips. I still feel numb right here, but I can feel skin. But I can also feel like kind of like needles when I touch here, and then if I put like lip balm on my lower lip, I can feel like kind of like a sense of electricity throughout. What do I want to say about this? I feel like it was totally life changing, and I feel so much more at ease in general. Like when I'm smiling, when I'm breathing, I feel like there's an absence of anxiety, and I kind of think it's because I can breathe a lot easier. I read somewhere that the adult um, airway should be 11 millimeter diameter. And I swear my airway was probably half of that because I would put so much effort into like deep breathing. And now I don't have to put a lot of effort into breathing, period. It's been really wonderful. Um, let's see. I just feel like I find myself smiling a lot more, like freely. I've had braces on for about like 7 years, partly due to the pandemic because we couldn't get adjustments unless it was like some sort of emergency. So that set me back a little bit and also set back the timing of my surgery and blah, blah, blah. But anyway, it worked out. I had a fantastic surgeon named Dr. Michael Bundy at the Kaiser in LA off of Sunset Boulevard. I would highly recommend getting a consultation with him. I have a different attitude about jaw surgery. I wasn't as educated about it until after the surgery because I think there were just questions I didn't even know to ask. My surgery took about 2 hours. I think it can take anywhere from 4 to 6 hours, which I believe is kind of a typical or common time frame. Mine took about 2 hours, which was pretty fast, but my case was also mild. So like if your jaw was like your jaw is supposed to be like I'm sorry, I don't know if this is like okay. So your jaw is supposed to be like this. Like your upper jaw is supposed to be like further than your bottom jaw, right? Mine was like slightly back, and then my upper jaw was kind of at a diagonal. So they had to move, the jaw back to line up, and then they moved the upper jaw forward a little bit. And then I think they have to consider, which is called, I'm not sure if it's called pitch or something. Like some people's jaw and can angle down or angle up, and they just want to make it kind of like more parallel to like the ground. I'm not sure if I'm explaining that correctly, but there's like a lot of calculation that goes into it. And I'm just gonna like say a bunch of things, but I think my surgery ended up costing about $140,000, and it was mostly covered by Kaiser because it was considered a medical surgery. It was they covered 130,000, so I had $10,000 that I had to pick up, and you can break that into payments without interest, so that was really fantastic. I think that a lot of insurance covers this because it's a skeletal issue and also a digestive issue, and it really can cause a lot of um, bad consequences down the road. Like when your bite is not lined up correctly, you might favor one side, like you might chew on one side, and it would cause like stronger muscles on one side of your face. You'll end up having a lopsided face, your teeth will like wear down. I mean, maybe that's not everybody, but that was my understanding of my case. And so even though jaw surgery seems so dramatic and so, when I say dramatic, I guess what I mean is really invasive. It seemed really invasive. So I very much avoided the procedure for a really long time. My case was considered mild, and but I'm really glad that I did it. I would recommend everyone just consider it if that was like brought to your attention for, because I don't know, I just feel like everything is so much better. But anyway, I'm gonna talk a little more about this as it comes to me. But right now I'm on month 4 of healing post double jaw surgery, and I feel like every few days my face changes a little bit. Like my nose gets a little bit smaller because I think there was a lot of swelling still there. And also the other thing is like, so what they did was they like cut right here, and then they also cut the jaw here. So I don't want to get into details, maybe in another video, but like where they cut has like these like calcium buildup in that area, so that hopefully will go away. I suspect like the face settling within like a year, maybe like maybe like, what is it, something like 9 months from now or something. But then I also saw these YouTube videos where people said it took a couple years for their face to settle and for them to get used to it. So we will see. But in this process of getting jaw surgery, I feel like I want to be much more seen. Like I'm more comfortable being seen. And it also motivates me to like work on the rest of my life. Because this particular thing of not feeling comfortable smiling has bothered me since I was 9 years old. So to have it fixed now at 45 years old, I really wish I did it sooner, but I'm glad that I did it. Um, so I just feel like it's the beginning. But anyway, I just kind of want to yap, I guess, about jaw surgery. Hopefully it helps somebody.